Good morning, everybody. Our today's class is Peritoneal Part 2nd. In this class, we are going to discuss peritoneal folds. The learning objectives for my today's class are: at the end of this session, students should be able to define and enumerate various folds of peritoneum, describe attachments, contents, clinical importance of falciform ligament, lesser omentum, Gastro, splenic, and renal ligaments. They should be also able to describe and trace disposition of greater omentum, enumerate its functions and role in peritonitis, describe mesentery and mesoorgan, which is a recent concept. They should also know the applied anatomy of peritoneal folds. Peritoneum is a continuous and larger serous membrane that lines abdominal cavity and covers most of the abdominal organs. In males, it forms a closed sac, but in females, it is open at the lateral ends of the uterine tubes. Peritoneum supports the viscera and provides a pathway for blood vessels, nerves, and lymphaticus. Disposition of peritoneum in horizontal section. It lines the body wall. At places it leaves the posterior abdominal wall or diaphragm to form partial or complete investment for viscera. Partially covered viscera are called retroperitoneal and completely covered viscera are called intraperitoneal. In fact, none of the viscera is truly intraperitoneal except ovary. These viscera lie outside the peritoneal cavity and are enclosed by peritoneum, so they are not truly intraperitoneal. As shown in this diagram, peritoneum lines the body wall, leaves the posterior abdominal wall to form a double-layered fold of the peritoneum called mesentery in case of small intestine. Some of the viscera are partially covered, such as ascending and descending colon. As shown in this diagram, these are called retroperitoneal, whereas a loop of gut is completely invested by the peritoneum, so we call it as intraperitoneal. But the fact is that this loop of gut is enclosed by the peritoneum on all sides. It is not truly intraperitoneal. As shown in this diagram, parietal peritoneum lines the parietes, while as visceral peritoneum, which is also called as serosa, lines the viscus. Viscus is attached to the body wall by means double-layered fold of the peritoneum. In case of the gut, we call it as mesentery. Between parietal and visceral layers is the peritoneal cavity. Also shown in this diagram is the viscus enclosed by peritoneum, attached to the posterior abdominal wall by a double-layered fold of peritoneum called mesentery. Vertical disposition of the peritoneum. As already said, peritoneum is a serous membrane that lines the abdominal pelvic cavity. It lines its anterior lateral wall, posterior wall, undersurface of diaphragm, and floor of the pelvic cavity, converting this abdominal cavity in a closed space in males, whereas in females this space is open due to the opening of fallopian tubes. Let us come to our today's topic, that is peritoneal ligaments. A ligament is a double-layered fold of the peritoneum. It connects one viscera with another or with abdominal wall and supports them. This double-layered fold of the peritoneum, since it comes from the posterior abdominal wall, it carries with it, since this fold of the peritoneum comes from the posterior abdominal wall, it carries with it blood vessels, nerves, lymphaticus, and at places contains variable amount of fat. These ligaments derive their name either from their shape or from their attachment with a particular viscera. Mesentery. Mesentery is defined as a double-layered fold of the peritoneum which attaches gut tube to the abdominal wall. Mesentery, it can be ventral mesentery or dorsal mesentery. Ventral mesentery attaches the gut tube with the anterior abdominal wall, whereas dorsal mesentery attaches the gut tube with the posterior abdominal wall. Ventral mesentery is present only in the region of the foregut. Dorsal mesentery is present throughout. Let us go to the functions of the mesentery. This double-layered fold of the peritoneum attaches viscera with the abdominal wall and supports them. It acts as a conduit for blood vessels, nerves, and lymphaticus. It also contains a variable amount of fat which acts as a reservoir of energy. If we take a horizontal section of the mesentery, it appears as a double-layered fold of the peritoneum which attaches a viscus with the abdominal wall. The term mesentery proper refers to the mesentery of small intestine. It suspends a viscera from posterior abdominal wall. As already said, mesentery is a double-layered fold of the peritoneum which attaches a viscus with abdominal wall. Mesentery proper refers to the mesentery of small intestine. Its function is to suspend a viscus from the posterior or anterior abdominal wall. Now if we take a longitudinal section of mesentery, mesentery attaches gut tube with the abdominal wall. As already said, dorsal mesentery is present throughout, as shown by this black dotted line. Ventral mesentery is present only in the region of the foregut. Developing liver divides the ventral mesentery into falciform, ligament, and lesser omentum. As shown in this diagram, where dorsal mesentery which attaches this gut tube with the posterior abdominal wall, ventral mesentery is present only in the region of the foregut. Liver develops in the ventral mesentery, thus dividing the ventral mesentery into the falciform ligament which lies between the anterior superior surface of the liver and posterior aspect of the anterior abdominal wall. Ventral mesentery between the liver and stomach is called the lesser omentum. Classification of the mesentery. As per the old concept, mesentery is divided into dorsal mesentery and ventral mesentery. Ventral mesentery we have discussed in the previous slide. The dorsal mesentery is further divided into mesentery proper. Mesentery proper, which is the mesentery of the small intestine. It invests jejunum and ileum, attaches them with the posterior abdominal wall, and contains superior mesenteric artery. Transverse mesocolon is the mesentery of the transverse colon. It attaches the transverse colon with the posterior abdominal wall. It contains middle colic arteries. Sigmoid mesocolon is the mesentery of the sigmoid colon. Attaches sigmoid colon with the pelvic wall and contains sigmoid arteries. Mesoappendix is mesentery of appendix, and its content is appendicular artery. Recently in 2012, a new concept has been given wherein transverse mesocolon, sigmoid mesocolon, and mesoappendix has been classified as meso-organ. As per this classification, mesentery is divided into two parts: mesentery proper, which represents the mesentery of the small gut, and meso-organ, which includes the mesentery of transverse colon, sigmoid colon, and mesentery of appendix. Thus, mesentery is double-layered fold of the peritoneum. It attaches jejunum and ileum to the posterior abdominal wall. It acts as a passage for the blood vessels, lymphaticus, and nerves. It also stores variable amount of fat. It plays some role in immunity due to the presence of macrophages. Route of mesentery extends from duodenojejunal junction to ileocecal junction. It is double-layered fold of peritoneum which attaches the jejunum and ileum with the posterior abdominal wall. It extends from the transverse process of L2, that is second lumbar vertebra, to right sacroiliac joint. It is just like the hem of a skirt. It is 6 inches long, that is the fixed margin, but encloses 6 meters long small intestine. Folding is due to the different lengths of these two margins. Arteries contained within the dorsal mesentery. The blood vessel is present in the dorsal mesentery or ciliate trunk, which is the artery of the foregut, superior mesenteric artery, which is the artery of the midgut, and inferior mesenteric artery, which is the artery of the hindgut. Recent studies about the mesentery. According to this new concept, mesentery is a continuous set of tissues formed by the double fold of peritoneum. Mesentery proper is used for the mesentery of small intestine. Mesenteric organ is sometimes used to refer to the rest of the mesentery that incorporates the mesocolon, mesoappendix, mesosigmoid, and mesorectum. It has been proposed for reclassification as an organ due to the research conducted in 2010. In conventional description, mesocolon was described as a fragmented structure with all the named parts, the ascending, transverse, descending, and sigmoid, mesocolonus, mesoappendix, and mesorectum, as separately terminating their insertions into the posterior abdominal wall. In 2012, following detailed electron microscopic examinations, a new concept emerged about mesentery. Now, what is the new concept? According to this concept, the mesocolon was shown to be a single continuous structure that starts from the duodenojejunal flexure and extends to the level of distal mesorectum. This simpler concept has enabled substantial advances in colorectal surgeries. It has also implications in surgery, anatomy, and development. Ligaments of liver. The ligaments of the liver are falciform ligament, lesser omentum, coronary ligament, and triangular ligaments. Ligaments and their nomenclature. Falciform ligaments are classified based on their shape. For example, falciform ligament, it is sickle-shaped. Triangular ligament, it is triangular in shape. If we go to the posterior superior surface of the liver, between the superior and inferior layers of the coronary ligament, there is a triangular area. By definition, this triangular area is called the triangular ligament because it is the triangular area between double layered folds of the peritoneum. Coronary ligament. Coronary means crown. This coronary ligament surrounds the liver like a crown but not like a cap, so it leaves certain areas uncovered. These uncovered areas which are not covered by the coronary ligament are called the bare areas of the liver. As shown in this diagram, in the right I have demarcated the superior layer of the coronary ligament. Black line, dotted line represents the inferior layer of the coronary ligament, and this bluish area represents the groove for inferior vena cava. So between these three structures we have the bare area of liver, which is the largest bare area of the liver, and it is called the bare area. Other bare areas of the liver are, we have groove for the other bare areas of the liver are porta hepatis, ligamentum venosum, groove for ligamentum venosum, groove from ligament teres, and gallbladder fossa. Ligamentous supports of the liver. Ligaments, as already said, is a double-layered fold of the peritoneum. Falciform ligament, which is sickle-shaped fold of the sickle-shaped fold of peritoneum. It has two margins or borders. Fixed margin or border is attached to the anterior abdominal wall, and free margin. This ligament resembles pars cerebri, which lies between the two cerebral hemispheres. It also has a fixed and a free margin. Pars cerebrum, the fixed margin of the pars cerebrum is attached to the superior sagittal sulcus. Falciform ligament also has free and fixed margins. Fixed margin is attached to the anterior abdominal wall and under surface of diaphragm. Free margin contains ligamentum teres, hepatica. The falciform ligament is a sickle-shaped fold of peritoneum which connects the anterior abdominal wall with the anterior superior surface of the liver. Falciform ligament. It is a sickle-shaped fold connects the anterior abdominal wall with liver slightly to the right of the median plane. If you trace it from the umbilicus, it is in the form of a double-layered fold of the peritoneum. Attachments of the falciform ligament. Anterior border is attached to the anterior abdominal wall and undersurface of the diaphragm as shown by these arrows. Posterior border is attached to anterior superior surface of the liver. It has a free margin which connects umbilicus to the liver. It contains the round ligament of liver or Ligamentum teres, hepatica in the free margin. In the body at three places we have Ligamentum teres, hepatica, Ligamentum teres uteri. This ligament is also called Ligamentum rotundum. It is attached to the corona of the uterus and attaches the uterus with the labia majora. Third Ligamentum teres is found attached to the head of the femur, and we call it as Ligamentum teres of head of the femur. Right and left coronary ligaments. Coronary means crown. It surrounds the liver like a crown. It covers it, but leaving certain areas uncovered. Those areas are called bare areas. As already said, it covers the liver like a crown, but not like a cap. So leaving certain areas bare. These areas are called the bare areas. Their reflections attach the liver to the undersurface of the diaphragm. The bare area lies between the superior and inferior layers of the coronary ligament. This is the anterior superior surface of the liver. Falciform ligament divides the liver into right and left anatomical lobes. Superiorly, falciform ligament splits into coronary ligaments which connect liver with the undersurface of the diaphragm. Falciform ligament divides liver into right and left anatomical lobes. To understand the disposition of the coronary ligament, let us go to the sagittal section of the liver. The visceral surface of the liver is covered by the inferior layer of the coronary ligament. Anterior superior surface and posterior surface of the liver is covered by the superior layer of the coronary ligament. Now, between the superior and inferior layers of the coronary ligament, an area of the liver which is not covered by the peritoneum is called the bare area. This bare area lies directly in contact with the undersurface of the diaphragm. So coronary ligament attaches the liver with the undersurface of the diaphragm. Triangular ligament. So between the superior and inferior layers of the coronary ligament, we have a triangular area. Since this area lies between the two ligaments, we call it as triangular ligament. Ligaments of the spleen or gastro splenic ligament between stomach and spleen. Spleno-renal ligament between spleen and kidney. Spleno-colic ligament between spleen and colon. Phrenico-colicosplenic ligament. Phrenico-colicosplenic ligament between the diaphragm and spleen. Since the spleen develops in the dorsal mesogastrium, it is connected with the stomach by means of gastrosplenic ligament. So gastrosplenic ligament lies between the spleen and stomach. Another ligament lies between the spleen and kidney. This we called as leno-renal ligament. Leno-renal ligament. Contents of gastrosplenic ligament are short gastric vessels, which includes both short gastric arteries and veins, left gastroepiploic vessels, lymphatic vessels, and sympathetic nerves. Leno-renal ligament is very important surgically because it contains splenic vessels, lymphatics, and nerves. Splenic vessels are very important when we go for the splenectomy. As shown in this diagram, we have gastrosplenic ligament with short gastric vessels and leno-renal ligament with splenic arteries. Ligamentous of stomach. Ligamentous of stomach are hepatogastric ligament, gastrosplenic ligament, gastrophrenic ligament, gastrocolic ligament, gastropancreatic ligament. Hepatogastric ligament is between stomach and liver. Gastrosplenic ligament, as already described, between the spleen and the stomach. Gastrophrenic is between the stomach and diaphragm. Gastrocolic ligament is between the greater curvature of stomach and transverse colon. Gastropancreatic ligament between the stomach and pancreas. Peritoneal folds below the level of umbilicus. To observe the peritoneal folds, on the posterior aspect of anterior abdominal wall, umbilicus is taken as landmark. The peritoneal folds below the level of umbilicus have a median fold between the umbilicus and apex of the urinary bladder, as shown by these red dotted lines. This median fold is called median umbilical ligament. Median umbilical ligament connects the apex of the urinary bladder with the umbilicus. It contains urachus. The second fold is lateral to the median umbilical fold. We called it as medial umbilical fold. And the fold lateral to the medial umbilical fold is called the lateral umbilical fold. Median umbilical fold. This double-layered fold of the peritoneum lies between the apex of the bladder and umbilicus. It contains a remnant of urachus called the median umbilical ligament. As shown in this diagram, a yellow encircled area represents the umbilicus. The second one represents the apex of the urinary bladder, and the double-layered fold which connects them is called the median umbilical fold. Medial umbilical fold lies lateral to the median umbilical fold, contains remnant of umbilical arteries. It is also called the median umbilical ligament. The lateral umbilical fold contains inferior epigastric artery. Inferior epigastric artery acts as a landmark for differentiating between the direct and indirect inguinal hernias. On the posterior aspect of the anterior abdominal wall, below the level of umbilicus, we also see various fossae. Supravesical fossae or concave depressions of the peritoneum in the paravesical space. They are bounded by the median and medial umbilical folds, as shown in this diagram. Red encircled area represents the supravesical fossa, which is bounded by the median and medial umbilical folds. It partially overlies the inguinal triangle and is usually occupied by bowel loops and the bladder fundus when the bladder is distended. The medial umbilical fossa lies between medial and lateral umbilical folds. Lateral umbilical fossa lies lateral to the inferior epigastric artery. To have a recap of these fossae and ligaments, let us go to this simplified diagram. In a section of abdomen below the level of umbilicus, on its posterior wall, we have median umbilical fold between the bladder and umbilicus, medial umbilical fold, and a lateral umbilical fold which contains inferior epigastric arteries. There is also supravesical fossa between median and medial umbilical fold, median umbilical fossa between medial and lateral umbilical folds, and lateral umbilical fossa lateral to the inferior epigastric artery. Now, what is Hasselbach's triangle? It is also called inguinal triangle. Its boundaries are medially, it is bounded by the lateral border of the rectus abdominis, inferior by the inguinal ligament, and laterally by the inferior epigastric artery. This triangle is important clinically because directly inguinal, they occur through the Hasselbach's triangle, lesser omentum. As already discussed in the previous class, double-layered folds of the peritoneum which attach the stomach with posterior abdominal wall or with some other viscera are called the omenta. Lesser omentum is also called hepatogastrodigital ligament. It lies between liver and stomach. It is divided into two parts. The part of the hepatogastrodigital ligament between the liver and the stomach is called gastrohepatic ligament, and the part which connects the first inch of the duodenum with the liver is called the hepatoduodenal ligament. What are the contents of free margin of the lesser omentum? The contents of the free margin of the lesser omentum are common bile duct, hepatic artery, and portal vein. You can remember the arrangement of these structures. D stands for dextro. It lies to the right and on anterior. Hepatic artery lies anteriorly and to the left. And portal vein, P stands for posterior, lies posteriorly. So the arrangement of the structures are in the free margin of lesser omentum is common bile duct lies on the anteriorly and to the right. Hepatic artery lies anteriorly and to the left. Portal vein lies posteriorly. You can remember the arrangement of these structures. D for dextro means on the right side. Hepatic artery lies anteriorly but on the left side. And portal vein, P stands for posterior, lies posteriorly. What is Calot's triangle? Calot's triangle is also called a cystohepatic triangle. It is a triangular region within the lesser omentum. It is bounded superiorly by the inferior surface of the liver, laterally by the cystic duct and the medial border of the gallbladder, medially by the common hepatic duct. The contents of this triangle are cystic artery and lymph nodes called lymph nodes of Lund. Importance during cholecystectomy. During cholecystectomy, surgeons identify cystic artery and duct, see for any variations and then ligates these vessels and cuts them in between ligatures. As shown in this figure, the surgeon first applies a ligature, then the second one, then cuts these vessels in between the ligature. Same is true for the cystic duct. But one thing is important to remember here, the cystic artery, though it lies in the Calot's triangle, it is true only in 64% of the cases because of the variations in the course of the cystic artery. At times, cystic artery may not be visible in this triangle. So careful dissection and identification of structures is needed in every surgery. A surgeon may follow duct first or artery first technique for during cholecystectomy. Clinical importance of free margin. Free margin of lesser omentum is very important clinically. While operating in this region, we have to keep in mind its contents, that is CBD, cystic artery and portal vein. Relation of these contents with the inferior vena cava, which lies posterior to the portal vein. And third important thing which we have to keep in mind is variations. In 36% of the cases, anatomical variations are present. We have to keep in mind there should be no injury to the contents or surrounding structures. Pringle in 1908 described a technique to minimize blood loss during hepatic surgery by clamping the vascular pedicle, which is present in the free margin. The inflow of blood to the liver is via hepatic artery and portal vein. Surgeons must be able to isolate and control these sources of blood flow to control bleeding not only in traumatic injuries to the liver but also in elective hepatic surgeries. Pringle's maneuver allows to evaluate traumatic liver injury. Clamp the free margin between the thumb and index finger of left hand. If the hemorrhage is from branches of hepatic artery or the portal vein, it stops when a clamp is applied to the pedicle. If hemorrhage continues, the other likely sources of bleeding include the retrohepatic vena cava and hepatic veins. Gastrosplenic ligament. Stomach is suspended from the posterior abdominal wall by the dorsal mesentery. Spleen develops in the dorsal mesogastrium. It is connected with stomach by gastrosplenic ligament as already discussed. The contents of gastrosplenic ligament are left gastroepiploic artery, short gastric artery, arteries, veins and lymphaticus. What is greater omentum? Greater omentum connects the greater curvature of stomach and first part of the duodenum to the transverse colon. It is also called the gastrocolic ligament. The part of the greater omentum between the greater curvature of the stomach and transverse colon is also called gastrocolic ligament. It hangs like an apron in front of small intestine after crossing the transverse colon. It is folded back on itself to be attached to the transverse colon. Now in this diagram, disposition of greater omentum has been made very simple. So we know that the stomach is attached to the liver by means of lesser omentum. Lesser omentum is basically a double-layered fold of the peritoneum. After attaching to the lesser curvature of the stomach, what happens? The anterior layer of this lesser omentum passes anterior to the stomach, as shown by this blue dotted line. So anterior layer of the lesser omentum passes anterior to the stomach, and posterior layer passes posterior to the stomach. The stomach becomes intraperitoneal. After reaching the greater curvature of the stomach, these two layers descend down and pass over the transverse colon to cover the intestine, then refold back on itself. So we have now 4 layers present in the greater omentum, 2 descending layers and 2 ascending layers. These layers can be named as first, second, third and fourth layer of the greater omentum. Space between third and fourth layer, as shown by this black and yellow dotted line, gets obliterated. So between the third and fourth layer lies the lesser sac, which lies posterior to the stomach. Thus third and fourth layer forms the lining of the lesser sac, which lies posterior to the stomach. Its extension downwards is obliterated by fusion of second and third layer, and the part of this greater omentum between the greater curvature of stomach and transverse colon is called the gastrocolic ligament. What are the contents of the greater omentum? Greater omentum basically it is double-layered fold of the peritoneum, so it contains fat deposits which are made up of different density of adipose tissues. Extraperitoneal connective tissue. Here you should not get confused. Why extraperitoneal connective tissue I have mentioned. In fact, only truly intraperitoneal organ is ovary. Others are wrapped by a double layer fold but or extraperitoneal. Same is true with this greater omentum. It is basically double layered fold of the peritoneum, so it contains extraperitoneal connective tissue. It also contains blood vessels, right and left gastroepiphytic vessels, lymphatics and lymph nodes. It also contains some aggregation of macrophages called milky spots. Now, what are the functions of the greater omentum? Due to the presence of these macrophages, it combats infection, isolates wound and infection, and limits intraperitoneal spread of the infection, many times found to encircle the concerned area of the trauma or infection, thus localizing peritonitis. Previously, greater omentum was called the policeman of the abdomen. It was believed that it moves to the site of inflammation by choice. Why greater omentum is called abdominal policeman? Policeman of abdomen. The role of greater omentum as policeman of abdomen was coined by Rutherford Morrison. Rutherford Morrison in 1906 coined the term the abdominal policeman. This concept has persisted for over half a century as it moves to the site of infection or perforation, seals and localizes it, and also helps in healing, thus prevent the spread of infection and peritonitis. Critics to the old concept, critical investigative work demonstrated that it has neither sensory power nor intrinsic mobility. Its only muscle fibers are those within the walls of the blood vessels. Its movement is entirely passive, and its involvement in an inflammatory process is matter of circumstances, not design. Although bactericidal activity has been demonstrated, it can be absent or totally remote without evidence of harm to the individual. So, since it does not move to the site of inflammation by choice but by chance, it is no more regarded as the policeman of abdomen. What are the bare areas of the stomach? Areas not covered by peritoneum are called the bare area. The part of the posterior surface of the fundus of the stomach between the two diverging layers of the gastrophrenic ligament, and also the lesser and greater curvatures or bare areas of the stomach, as shown in this diagram. What is mesentery? Mesentery, as already said, it is a double-layered fold of the peritoneum containing small intestine to the posterior abdominal wall. Mesentery has two borders. Attached border to the posterior abdominal wall. It is called the root of the mesentery. It extends from transverse process of L2 to the right sacroiliac joint. It has a free border which encloses the jejunum and ileum. The contents of the mesentery are vessels, nerves, lymphaticus, and fat. What is mesenteric organ? Mesocolon is the peritoneum for the large intestine. It is divided into transverse mesocolon which is the mesentery of the transverse colon. It divides the abdominal cavity into supra and infracolic compartment. Sigmoid mesocolon represents the mesentery of the sigmoid colon. Mesoappendix is the mesentery of the appendix. Together they are called the mesenteric organ. The concept of mesenteric organ, as already said, was given in 2012. Peritoneal folds. To have a recap of the peritoneal folds, let us go to this diagram where the abdominal viscera have been removed. So lesser omentum is a double layered fold of the peritoneum which lies between the stomach, lesser curvature of the stomach, first part of the duodenum and liver. Transverse mesocolon represents the mesentery of the transverse colon. It divides the peritoneal cavity into supra and infracolic compartments. Mesentery proper represents the mesentery of the small intestine. It extends from the transverse process of L2 to the right sacroiliac joint. Sigmoid mesocolon represents the mesentery of the sigmoid colon. Mesoappendix is the mesentery of appendix, which contains appendicular artery. Functions of these peritoneal folds. Basically, they are double layered folds of the peritoneum, so they support the abdominal viscera. They carry blood vessels, arteries, veins, and lymphaticus. They store variable amount of the fat due to presence of macrophages. They have some role in the immunity. I want to summarize my lecture as: a ligament is a double layered fold of peritoneum. It suspends abdominal viscera from abdominal wall or connects them with each other. These double layered folds of peritoneum contain variable amount of fat, blood and lymphatic vessels, nerves and lymphatic. They also provide immunity. Divide the peritoneal cavity into the compartment, as is true of this transverse mesocolon, which divides the peritoneal cavity into supra and infracolic compartments. Mesentery of the small intestine and colon has been recently classified into mesentery proper, that is mesentery of the small intestine, and mesenteric organ, which represents the mesentery of the transverse colon, sigmoid colon, and mesentery of the appendix. This classification is important surgically. Now let us go for a quiz based on this lecture. You will be provided an MCQ with 4 options. You have to find the most accurate one. Which of the following statements is not true about a ligament? It is a double layered fold of the peritoneum. B. May contain blood vessels. C. Connects organs with each other or with abdominal wall. D. Always has a fixed and a free margin. So wrong choice is D. Which of the following is a truly intraperitoneal organ? Uterus, stomach, intestine, ovary. The answer is ovary. Though we label the organs as intraperitoneal, but actually they lie within the double layered fold of the peritoneum. They are not the contents of the peritoneal cavity. Ovary is the only abdominal organ which is truly intraperitoneal. Which of the following is true about greater omentum? Attaches to the greater curvature of the stomach. B. Gastrocolic ligament is component of it. C. Always reaches site of inflammation. D. It localizes perforation. C is the wrong option. Always reaches site of inflammation. Previously it was believed that it reaches the site of inflammation, so it was called the policeman of the abdomen. But the recent advances have shown that it reaches the site of inflammation only by chance, not by choice. Which of the following is not a content of gastro-splenic ligament? Short gastric arteries, short gastric veins, lymphaticus, short gastric nerves. The answer is D. Though it contains autonomic nerves, but these nerves have not been named as the short gastric nerves. Which of the following statements is not true about falciform ligament? It has a fixed margin. It has a free margin. Free margin contains ligamentum teres, hepatica. It is derivative of the dorsal mesogastrium. It is derivative of dorsal mesogastrium is the wrong option because it is derivative of the ventral mesogastrium. Which of the following statements is not true about lesser omentum? Attaches lesser curvature of stomach with liver. B. Free margin contains hepatic artery, common bile duct and portal vein. C. Free margin forms anterior boundary epiphyseal foramen. D. Free margin contains hepatic artery, common hepatic duct and portal vein. So D is the wrong answer. Common hepatic duct and portal vein. It is CBD, common bile duct, which is the content of the free margin of lesser omentum, not common hepatic duct. Which of the following structures does not form anterior boundary of foramen of Winslow? Portal vein, pre-margin of lesser omentum, inferior vena cava, common bile duct. As already explained, anterior boundary of the foramen of Winslow or epiploic foramen is formed by the free margin of lesser omentum, and its posterior boundary is formed by the inferior vena cava. It is also said that foramen of Winslow lies between two great veins, the anteriorly portal vein and posteriorly inferior vena cava. So inferior vena cava, C is the wrong option, which it forms the posterior boundary of foramen of Winslow, not the anterior one. Which of the following statements is not true about mesentery? Mesentery is a double-layered fold of the peritoneum. B. Transmitous blood vessels only. Mesentery proper is mesentery of small intestine. Contains fat. B is the wrong option. Transmitous blood vessels only. In addition to blood vessels, it also transmits lymphaticus nerves. Which of the following statements is not true about meso organ? Includes transverse mesocolon, transmitous blood vessels only, includes sigmoid mesocolon, includes mesentery proper. In the recent classification, meso organ includes the mesentery of the transverse colon, mesentery of the sigmoid colon, and mesentery of the appendix, which we call as mesoappendix. Mesentery proper is the mesentery of the small intestine. It is not included in the meso organ or mesenteric organ. So option D is wrong. Which of the following structures develops in dorsal mesogastrium? Spleen, kidney, both, pancreas. The correct option is spleen. Inferior epigastric artery is the content of which ligament? Falciform ligament, median umbilical ligament, medial umbilical ligament, lateral umbilical ligament. Correct choice is lateral umbilical ligament, contains inferior epigastric artery. Which type of hernia occurs through inguinal triangle? Inguinal, femoral, direct inguinal, indirect inguinal. It is direct inguinal hernia which occurs through inguinal triangle. Thank you for watching this video. Do subscribe this channel. Press on the bell icon to remain updated. Do not forget to subscribe my channel. Press on the bell icon to remain updated about more video uploads.